we're actually going to talk about the perinatal mental health conditions. I will be covering this, speaking of the different kind of mental health conditions you might come across. I say that because just as you have a mental representation of what depression or anxiety looks like, people do also. And if how they are experiencing doesn't match their view of depression, they might not realize they're depressed. First of all, there is depression versus the baby blues. Most people will have the baby blues because that truly is about the hormonal fluctuation. So when we're pregnant, we have the highest level of estrogen our body has ever experienced. Right after birth or miscarriage, the estrogen level that's been the highest it's ever been drops at a below postmenopause level. So try to imagine that. Your level of estrogen drops to a postmenopausal level. And that drop is just such a shock to the body and to the mind that it leads to what we call the baby blues, which really means instability of mood. So you could be crying one moment and truly have the feeling of, I don't know why I'm crying. And you could be laughing a moment and have the feeling of, I don't know why I'm laughing. It's that kind of just biological roller coaster without it being tragically dropping. It's just like, yeah, flapping around. And it's not constant, it's not consistent. So it can come in bouts of 15 minutes and then not, etc. And so I'd say the baby blues are, I'd want to say 100% of people, but I think statistics have it at 75% or something like that. Um, I would say it's universal. In other words, you find it everywhere in around the world. Depression, on the other hand, is something that lasts longer. So the baby blues have a finite amount of time. It's, your hormones come back to a general level of stability. And that could be 4 to 6 weeks. But anything beyond, I'd say after 4 weeks, if somebody expresses sadness, loneliness, depression, isolation, and things like irritability, agitation, because that too is part of depression. It's just not the kind of depression we imagine, the one where the person is staying in bed, has no motivation, can't do anything. There is something called agitated depression, where the person is highly irritable, sort of like maybe a more acute version of being premenstrual. That also is depression. So that's something that lasts beyond the 4 to 6 weeks, and can go on for a long time. In a support group that our peer supporters are doing with Black moms who've had babies in the NICU, when they were talking about postpartum depression at one point, one of the mom realized, oh my God, that's what I have, but I didn't know it was that because I thought postpartum depression is something only for the first 2 months. And the fact is, postpartum depression can be, well, I can say forever, but no, technically can go on for at least 2 years. And it can return if the parent has been breastfeeding. when they wean the baby from the breast, the depression can return. So there is that to keep an eye on as well. Then we have the anxiety disorders, which can be a generalized anxiety disorder, but with pregnancy and postpartum, it tends to increase in intensity and have a more obsessive compulsive quality to it. And we'll talk more about what that means. People can develop panic disorder or, basically have panic attacks. Uh, that include the partners or the husbands, by the way. Um, and there is the post-traumatic stress disorder that can come from the trauma of birth or the trauma of pregnancy. There are various traumas that can happen, obviously, many of them medical in nature, unfortunately. And you also have people who have had past traumas, especially around sexual abuse, who are re-traumatized by the medical experiences during pregnancy and postpartum.